often the clinical signs of a nutrient imbalance are vague, difficult to diagnose, and not top of the differential diagnosis list. One of the most common ones are lysine and essential amino acid deficiencies, and that's primarily because the most important nutrient, most expensive nutrients for manufacturers to include are lysine, essential amino acids, biotin, and vitamin E. So they're quite commonly deficient in most diets. Calcium-phosphorus ratio, it's not just, we have a lot of oxalate containing pastures here, but the calcium-phosphorus ratios are actually borderline or below minimum in many, many horses that are hand-fed. Another big problem we see is overlap, where people use several supplements or they're using a manufactured feed and throwing in a few more supplements. The diet can still be deficient, but certainly we have cases of overlap. Excess selenium, something we see, chronic hoof problems, and it's not usually something that's considered, but if you have a look at the diet, you'd be surprised sometimes at what people are feeding. Excess vitamin A is another one. It causes bone fragility, and a lot of manufacturers are pretty keen to add vitamin A, and the synthetic form is actually predisposes the horse for more toxicity than the natural form in lysine hay. Sugar and starch levels too high, and the nutrients below recommended daily intakes. So first we're going to look at the lysine amino acids.